Hi, it's Dr. Gruss, and I'm here to talk to you this time about skeletal muscles. And what I want to do is give you a general introduction to how skeletal muscles work, so their real general structure and their general function. And it might seem that a lot of this stuff that I'm going to go over with you right now is pretty obvious, but I have found in my experience that many of these things need to be laid out very explicitly, because students do get somewhat confused about them, and it will really help you to understand skeletal muscles in general and how they're set up and how they work. All right, so as you know, there are three different types of muscle tissue. Smooth muscle tissue, which is involuntary, you can't control it. It's found in lots of different places in the body, from the inside of the blood vessels to the little erector pili muscles that pull up the hairs and when your hairs stand up on your skin. Cardiac muscle tissue, which is found in the heart, which is of course also involuntary. You can't control that voluntarily. And then skeletal muscle tissue. And that's what creates our muscles, our named muscles that move our skeleton. And skeletal muscle is, of course, voluntary muscle. That is, we can control it on purpose. All right. So let's talk first about the general gross structure of muscles. And by gross, I mean what you can see with the naked eye. So up until now, you've probably been learning a lot about the microscopic structure of muscles. And here I want to talk about the gross structure of muscles. So I want to run through some root words with you and just some real general facts about how muscles are built. So first of all, the fleshy part of a muscle, so we're looking here at the muscles of the arm. This is biceps brachii, the muscle when you make a muscle in your arm, that's the one that pops up. This is another muscle called brachioradialis that moves the elbow, and back here you might know is your triceps brachii muscle. So your tris and bis, you athletes will refer to them as. So the muscle has this fleshy belly that's called the body of the muscle, sometimes referred to as a head. And in Latin, we'll see that term seps, which means head, or sometimes it's called the belly of the muscle. And then we might see this prefix gastro, which means belly. The fleshy belly body part of the muscle is the part that we eat if we eat meat. Now, where do muscles attach? So skeletal muscles, almost all skeletal muscles attach to bones, and almost all skeletal muscles attach to at least two different bones. There are some exceptions. For example, the muscles that allow you to make facial expressions attach to your skull on the deep surface, but then they attach to the deep surface of your skin. So they actually only attach to a bone on one end. But most skeletal muscles move joints. And to do that, they attach to at least two different bones or to connective tissue that is attached to those bones. So for example, this muscle brachioradialis, you can see right here, attaches to the humerus proximally and to the distal radius distally. Muscles do not, so they move joints, they do not attach to joints. They do not attach to articular surfaces. So for example, a muscle will not attach to the femoral head or to the humeral head. Remember that those articular surfaces are covered with articular cartilage, and muscles don't attach to that. Muscles may attach to bone through a tendon. So a tendon is a tough connective tissue structure that attaches a muscle to a bone, more specifically to the periosteum of a bone. We have names for the different attachment sites of muscles. The origin of a muscle is the part that doesn't move, and the insertion is the attachment on the bone that does move. So in the case of brachioradialis, the origin is here on the distal humerus, and the insertion is here on the distal radius, because when that muscle moves, it flexes the elbow, which causes the radius to move. The humerus doesn't move in that case. Oops. I think that there is another lecture that you'll see that's all about this topic. But in general, be aware that the name of a muscle usually describes it, either its appearance or its location, or its attachments, or its action, or some combination of all of those things. For example, brachioradialis here, brachial refers to the humerus, and radialis obviously refers to the radius. Here's another example. There's a muscle called flexor hallucis brevis. So flexor tells you that it's a muscle that causes flexion. Hallucis refers to the hallux, the big toe, and brevis means short. So this is the short flexor of the big toe. So these names are mostly in Latin. Sometimes you'll see some Greek in there, but if you can learn what those Latin words mean, they'll help you understand what that muscle is, what it does, what it looks like, and so on. Now, there are many muscles that have more than one head or belly. And for example, we see a couple of them right here. So biceps means two, like bicycle, two heads. And triceps means three heads. The muscle quadriceps in the thigh it's actually composed of 4 separate muscles, but they all converge on a similar, or on the same tendon. So it's called quadriceps. So it's pretty common that we see muscles that have more than one head. What will happen, and I can't think of any exceptions to this, is that each of the heads will have its own proximal attachment, that is its own origin, and a common distal insertion. So they have their own origin. So for example, with biceps here, it attaches to, the two heads attached to the scapula in 2 different places. But distally, those 2 heads converge on a common tendon, which then has its insertion at one single point on the radius. So keep that in mind when you're looking at muscle names as well. One other thing to point out is that another place that muscles can attach to, in addition to attaching to bones, many muscles, especially in the limbs, attach to other bits or sheets of soft tissue. So what we're looking at here is a cross-section through the thigh. And so this is the femur right here. And you can see that there are muscle groups here. This is anterior, this is the quadriceps. And this is posterior, this is medial. In between those different muscle groups is a tough, thick sheet of connective tissue called the intermuscular septum. So this is a sort of like a tendon, but the muscles on either side of it attach to that intermuscular septum. So that's another place that muscles can attach. All right. So that gives you sort of a general overview of skeletal muscles, especially in the limbs. Now, the next thing I want to talk about is how skeletal muscles work. And again, in a very general sense. So the way we're talking here about skeletal muscles that move joints. The way that they move joints is that they have to cross the joints, okay? So a muscle will move a joint that it crosses. For example, biceps brachii here, as I said, attaches to the scapula proximally. It has its origins on the scapula. And then its distal insertion is on the radius. And so biceps brachii crosses the elbow joint, and it moves the elbow joint. Muscles can only move joints that they cross, okay? This seems like fairly common sense, but again, I'm basing these overview points on mistakes that I've seen students make in the past. So biceps brachii cannot move the wrist because it doesn't cross the wrist joint. Similarly, biceps brachii is not going to move the scapula because it doesn't go from the scapula back to the axial skeleton. So muscles are only going to move joints that they cross. Now, the next question, of course, is how? How do muscles move joints? So biceps brachii is primarily an elbow flexor. How does it move the elbow joint? So remember, elbow flexion is like this. Brachioradialis, I showed you a minute ago, is also an elbow flexor, but we've got biceps brachii up here, and it's primarily an elbow flexor as well. How does it create that movement? Well, the answer is that muscles create movement by pulling on a bone. So here's a little animation of biceps brachii, and it is pulling up on the radius. So the way that it's bending the elbow is by pulling up on the radius. And I always like to imagine a skeletal muscle working like this. Imagine that there's a little person standing near the origin of the muscle, and there's a rope attached to the insertion of the muscle. When the person pulls on the rope, what will happen? It will create movement. So in this case, biceps brachii will pull up on the radius, and that causes elbow flexion. If you're looking at a muscle in lab or in the picture, you can often see the fascicles of the muscle, and that's what these sort of stringy bits in the muscle are here. They are oftentimes, not always, but often running along in the direction of the muscle pull, because essentially each of those fascicles is pulling on that bone. So you can see that in biceps brachii, those fascicles are running up and down vertically or proximo-distally, and that's the direction of pull of the biceps muscle. Now it's important to remember that muscles only pull, they never push, okay? So biceps over here can pull on the radius, and that causes flexion of the radius. Biceps cannot cause extension of the elbow because it can't push on the radius. From this side of the elbow, it would require we push the radius down in order to extend it, and biceps can't do that. Biceps can only pull, muscles can only pull on their insertions. So the next question is, okay, so they create a movement by pulling. How do they create that pulling force? And a pulling force is called a tension, okay? So how do muscles manage to create that tension, that pulling force? The way that muscles do this is by shortening. And you can see that if you look at this animation here. When the elbow is extended, let's see if I can stop it. Nope. When the elbow is extended, biceps is stretched out to its maximal length. When the elbow flexes, you can see that biceps actually shortens. The muscle itself shortens in length. And that shortening then pulls up on the radius. So another way that I like to think of muscles is sort of like elastic bands or rubber bands. If you were to attach a rubber band that went from the scapula up here across the front of the elbow down to the radius, if it was stretched out, the radius would be extended, but when that elastic band shortened, when it sprung back, it would pull up on the radius, okay? So in addition to creating a movement like this by shortening and creating a pulling force, muscles can actually do other things while creating tension, but without necessarily shortening. And I'll talk about that in a different lecture, the different types of muscle contractions that depend on whether the muscle is actually shortening or not. So they can, by creating that tension force, a muscle can either create movement, like biceps is doing in this animation here, or it can stop movement, or it can actually control the rate of movement in the opposite direction, or limit the rate of movement in the opposite direction. All right, so muscles cross joints. They only move the joints that they cross. They pull on bones by shortening, and that's what creates movement. Now, another thing to keep in mind is that the exact movement or action that a muscle produces depends not only on which joint it crosses, but where or how the muscle crosses that joint. Okay, so the action of biceps brachii is to flex the elbow. When it contracts, it pulls up on the radius and causes the elbow to flex. Now, biceps crosses anterior to the elbow joint. And I wish that we were in the classroom because I like to show this to you. I'm going to stand up for a second and back up here. If you sort of put your hand down here to the radius where biceps attaches, anterior to the elbow, and pull on your own arm, on your skin or on your sleeve, you can see that that elbow will flex. But there are other muscles that cross the elbow joint. We talked about brachioradialis, which also crosses anterior to the elbow joint, and when it contracts, when it shortens or creates a tension force, it also pulls up on the radius or pulls anteriorly on the radius, which flexes it. But triceps brachii back here goes from the proximal humerus and scapula down to the olecranon process, that is the point on your elbow, which is on the ulna. It crosses posterior to the elbow joint, behind the elbow joint. And if you were to make your hand go kind of where triceps goes, down to the olecranon process, and pull on that, what will happen when you pull is that the elbow will extend. So by virtue of being posterior to the joint, triceps is an elbow extensor. By being anterior to the joint, biceps is an elbow flexor. Now, I should have pointed out here, I should have written this down, but I didn't, that biceps, of course, not only crosses anterior to the elbow, but it also crosses anterior to the shoulder joint, right? So I told you that the two heads of biceps originate on the scapula. So it crosses anterior to the shoulder joint as well as anterior to the elbow joint. And if I go back to this previous picture, you can see that in addition to the elbow flexing, when biceps contracts, it also flexes the shoulder joint. That is, this muscle also pulls forward on the arm, which causes the shoulder to flex as well. So there are many muscles that cross multiple joints, and they will move any of the joints that they cross. What movement they cause at any particular joint depends on how they cross that joint or where they're located relative to that joint. So biceps and triceps is a good example of this next point. Muscle groups or muscles that cross the same joint on opposite sides of the joint are going to have opposite actions at that joint. So here are a couple of examples from the lower limb. Our hip flexors are located anterior to the hip joint, and our hip extensors are located posterior to the hip joint. So these muscles will pull forward on the humerus, which causes hip flexion. These muscles will pull backward on the humerus, or sorry, not humerus, femur. Let me start that over again. These muscles will pull forward on the femur, which causes hip flexion, and these muscles will pull backwards on the femur, which causes hip extension. Same or similar situation for the knees, although the knee is set up differently. The quadriceps muscles pull forward on the tibia. They are on the anterior thigh, and they are extensors of the knee joint. They straighten the knee joint. The hamstrings muscles cross posterior to the knee joint. They pull backwards on the tibia, and so they flex the knee. So opposite actions on opposite sides of the joint. As I said, there are many muscles that cross multiple joints, like biceps that we just looked at. The hamstrings are another case. So your hamstrings are your posterior thigh muscles back here, and they cross both the hip and the knee posteriorly. So they will move both the hip and the knee. But you'll notice that those crossing those two joints that way has opposite actions. So the hamstrings cross posterior to the hip, which means they are extensors of the hip, and they cross posterior to the knee, which means they are flexors of the knee. So the hamstrings muscles then have two different actions. They can extend the hip and they can flex the knee. And that's not unusual. Biceps is a flexor of the shoulder and a flexor of the elbow, and it's actually also a supinator of the forearm. So many muscles have more than one action. But remember that almost no muscles are going to have opposite actions at the same joint. So hamstrings, as we just saw, have opposite actions at two different joints, extending the hip and flexing the knee. But there are almost no muscles that will have opposite actions at the same joint. So I've often had students write on tests that such and such a muscle flexes and extends the knee. There's no muscle that both flexes and extends the knee. The reason being that it would have to be on both sides of the knee joint to do that. Either that or it would have to both push and pull. And we know that neither one of those things can happen. One exception would be deltoid, which is this muscle marked up here with the black star, because deltoid actually does wrap around the shoulder joint. So if I show you, oh, and it's not in there, sorry. So deltoid actually does wrap around the shoulder joint. It crosses both anterior to the shoulder joint and posterior to the shoulder joint. So it can actually flex and extend the shoulder both. But there are very few muscles that are able to cause opposite actions at the same joint. As I said, it's not unusual for a single muscle to have opposite actions at different joints. So I mentioned the hamstrings. Rectus femoris here, which is one of our quadriceps, is another example. It crosses anterior to the hip and anterior to the knee, which means it will flex the hip and extend the knee. All right, so I hope that overview is helpful to you as you begin studying muscles and learning what their actions are and their attachments. The goal here is for you to not have to memorize every single muscle fact individually. Once you know some things about a muscle, you should be able to infer other things. So for example, if you can remember that rectus femoris attaches to the anterior part of the ilium and down anteriorly to the patella, you should be able to figure out that it will flex the hip and extend the knee. Feel free to ask me if you have any questions. I'm always happy to help.